Reproductive health in women encompasses a broad spectrum of physical, mental, and social well-being related to the reproductive system at all stages of life. It is a fundamental aspect of overall health, influencing not only the biological ability to reproduce, but also the capacity to make informed decisions about reproduction and access to comprehensive healthcare services. Despite its importance, reproductive health in women often faces significant challenges worldwide, shaped by cultural, social, economic, and political factors that create disparities in access, awareness, and treatment. One of the key aspects of reproductive health is ensuring access to safe and effective contraception. Women have a right to choose if, when, and how many children they want to have. Contraception provides the means to exercise that choice, yet millions of women globally still face barriers to accessing contraceptive methods. These barriers can include lack of information, cultural stigma, affordability issues, and insufficient availability of options. Furthermore, in regions where contraceptives are accessible, there may still be limitations in ensuring informed choice. Women need to be fully aware of the advantages, risks, and usage of different methods to make decisions that best suit their individual circumstances. The need for comprehensive education is equally important. Understanding reproductive health begins with education about the body's functions, sexual health, and the risks of sexually transmitted infections, STIs. Unfortunately, there are stark differences in how this information is disseminated across countries and communities. In some areas, reproductive health education is a neglected topic, often excluded from curricula due to societal taboos or conservative views. This lack of awareness can lead to unintended pregnancies, unsafe abortions, and vulnerability to STIs, contributing to preventable reproductive health complications. Providing accurate, age-appropriate, and culturally sensitive education can empower women and girls to protect their health and make informed decisions about their lives. A critical dimension of reproductive health is access to maternal health care, which includes prenatal, childbirth, and postpartum care. The quality of maternal health care directly affects outcomes for both mothers and infants. Inadequate care can result in complications such as maternal mortality, preterm births, and low birth weights. While advancements in healthcare have significantly reduced maternal mortality rates in developed regions, the same progress has not reached many developing countries. Here, women may face a lack of skilled healthcare providers, insufficient facilities, or financial constraints that prevent them from accessing care. Addressing these disparities requires investments in healthcare systems, training for medical professionals, and community outreach programs that prioritize maternal health. Equally important is addressing gender-based violence and its impact on reproductive health. Violence against women, including sexual violence, intimate partner violence, and female genital mutilation, can have devastating consequences on physical and psychological well-being. Survivors often experience reproductive health issues such as STIs, unintended pregnancies, and complications related to injuries. Additionally, the mental health toll of violence can interfere with women's ability to seek care or make decisions about their health. Combating gender-based violence requires a multifaceted approach, including legal protections, support services for survivors, education to challenge harmful norms, and community engagement to foster safer environments. Reproductive health services also include screening and treatment for gynecological conditions such as cervical cancer, polycystic ovary syndrome, PCOS, and endometriosis. These conditions can significantly affect a woman's quality of life, yet they are often underdiagnosed or undertreated due to limited awareness, stigma, or insufficient resources. Regular screenings and early detection are essential in managing these conditions, but challenges such as cost, access to specialists, and cultural attitudes toward gynecological exams can hinder women from receiving necessary care. Promoting awareness, investing in research, and improving healthcare infrastructure are vital steps in addressing these issues. The intersectionality of reproductive health with socioeconomic factors cannot be ignored. Poverty, lack of education, and limited access to healthcare disproportionately affect women's reproductive health outcomes. Women in marginalized communities often face compounded challenges, including higher rates of unintended pregnancies, reduced access to maternal care, and increased vulnerability to STIs. Social and economic empowerment, through education and income-generating opportunities, can play a pivotal role in improving reproductive health. When women have greater agency over their lives, they are better equipped to make health-related decisions and advocate for their rights. Cultural attitudes and societal norms also shape the discourse around reproductive health. In many societies, discussions about women's reproductive rights and health are still met with resistance, rooted in traditions or misconceptions. These attitudes can perpetuate stigma and silence around important topics such as menstruation, contraception, or infertility. Changing these narratives requires community-level interventions that challenge harmful norms and promote a more inclusive understanding of reproductive health. Media campaigns, education initiatives, and grassroots efforts can foster dialogue and encourage supportive attitudes. Technological advancements have the potential to revolutionize reproductive health care. Innovations such as telemedicine, mobile health applications, and wearable devices offer new ways to deliver information and services. For women in remote or underserved areas, these technologies can bridge gaps in access and provide timely support. However, the digital divide remains a challenge, as not all women have access to the internet or mobile devices. Efforts to expand connectivity and ensure digital literacy are necessary to maximize the benefits of technology in reproductive health. Globally, there is increasing recognition of the need for a rights-based approach to reproductive health. This framework emphasizes that reproductive health is not just a medical issue, but a fundamental human right. Women should have the autonomy to make decisions about their bodies and access services without discrimination or coercion. International agreements such as the Sustainable Development Goals, SDGs, have highlighted the importance of gender equality and reproductive health in achieving broader developmental objectives. Governments, non-governmental organizations, and communities must collaborate to uphold these rights and implement policies that prioritize women's health. The role of men and boys in promoting reproductive health should not be overlooked. Engaging them as allies in discussions about contraception, gender-based violence, and reproductive rights can foster mutual understanding and shared responsibility. Inclusive education that involves all genders can challenge stereotypes and build more equitable relationships, ultimately supporting better reproductive health outcomes for women. In conclusion, reproductive health in women is a multifaceted issue that touches on individual rights, societal norms, and systemic challenges. Ensuring the well-being of women in this domain requires a holistic approach that integrates education, access to healthcare, community engagement, and policy advocacy. By addressing barriers and empowering women, societies can create environments where reproductive health is not just a privilege, but a guaranteed right for all. The journey toward this goal is complex, but it is a crucial step in building healthier, more equitable communities worldwide.